Hello, and thank you for joining me for another episode of You Would Think. For full disclosure, I am not an attorney. I do not have a law degree. My degree is in forensics and crime scene technology. I'm not offering any legal advice. This is a trial channel where we talk about trials, engage in them. I like getting your perspective on them as well. And just being able to basically have a community of people that all kind of like the same thing, and we can all bounce ideas off each other and so on and so forth. So again, no legal advice is given, and go ahead and let's get to it. All right, so we are on day 9 of Lindsay Clancy's murder trial, and we finally get to hear from some mental health experts, from her psychiatrist, Jennifer Tufts, who's been mentioned a few times throughout this trial, and also a psychiatrist, Dr. Alia Goodheart, who worked at the Mclean Institute that Lindsay was at for a couple weeks before this tragedy occurred. So the first witnesses of the day, one of them was one of the daycare workers at the daycare that the children were dropped off at. Basically, her testimony, I believe, was used to show that she didn't really notice anything out of the ordinary with Lindsay. Then they called a friend of hers, Sarah Carney. They talked about having a bonfire like the night before, and just in general, like girlfriends. And she also never saw anything other than that she was anxious about going back to work, and that she was, having a really hard time sleeping. So the first medical expert of the day was, like I said, Dr. Alia Goodheart. She worked at the Mclean Institute that Lindsay went to a few weeks prior to this tragedy occurring. And one thing I noticed about her, kind of off the jump really, this woman did not seem to know very much about mental health. Like, I don't know, man, she didn't. She just seemed really, I don't know, elusive, if that's the right word. She just did not seem like she really knew what she was talking about when she was pressed a few times, especially on cross, if you could imagine. She kind of took the backdoor way of explaining things a lot of times, rather than just answering the question. But, so, like I said, so the defense, they did a really good job, I thought, of highlighting the fact that she didn't seem to know much about mental health in general, or Lindsay's past. And they did a good job at poking holes in her credibility there. Then at one point during cross, they have this back and forth about, maybe she didn't understand the question, maybe he didn't understand the answer, and somehow or another that entire conversation got wrapped up in insurance. I'm not really sure what insurance had to do with this whatsoever, rather than just saying, hey, did your insurance pay you or not? And, Kevin Reddington, the defense attorney, he did not understand that either. So they kind of just get in this little tit for tat type of thing. Then they go ahead and move on when it's clear that you're not going to get anywhere with that line of questioning. Another thing that was covered was the defense had suggested in their opening statement that when Lindsay left that hospital, that she was not provided any discharge paperwork. With resources and things like that, when you're at the hospital and they gave you the folder when you leave and it's got resources and phone numbers and things like that. They claim that she was not provided those things. So one thing the prosecution was able to do with her is on redirect, they physically showed the paperwork that she was given, and it had resources. It had social worker information. It had the 98 crisis lifeline information. It had a direct line to a nurse she could call anytime, 24/7, if she needed someone to talk to, or was really finding herself struggling. So that was introduced. That was a good point by the prosecution. Lord knows I have not had very many of those. And she also was asked numerous times by the prosecution if he thought that Lindsay was a danger to herself or anyone else, that she would have not been discharged. And she said that Lindsay didn't say anything regarding wanting to harm herself or anyone else. And that's how the whole AMA, against medical advice, debacle occurred. Is when the prosecution suggested she left AMA, Kevin Reddington put in his 2 cents, and they kind of had a little back and forth heated argument with the judge, which we'll go ahead and we'll take a look at that real quick.
End of the 3 days, you deem them to be safe. Are they allowed to leave?
Yes.
And is there something in the field of psychiatry or in your training and experience in your time at Mclean about being discharged against medical advice?
He wasn't discharged AMA.
We'll allow set the really the terms and where we are, so you can go into that.
AMA is not applicable.
If we can approach...
Yeah, I don't think you heard me.
I did hear you.
All right, well then, I'm going to allow that question. There, your rights are saved.
My objection.
Yeah, I've noted it. Go ahead, counsel.
Thank you.
I think we tend not to do against medical advice, because if we are concerned about somebody's safety, we would not discharge them.
So as you can see, tensions are definitely running high. And so at that point, the prosecution was really trying to get Dr. Goodheart to latch on to that, because Lindsay wanted to go home a couple days early so she could attend her daughter's birthday party, that was the same as leaving AMA against medical advice, which it's not, because Dr. Goodheart would not latch on to that theory. And the best that they were able to get her to agree to is that if she had been having any of the suicide or homicidal thoughts or concerns, that they wouldn't have discharged her. So it wasn't that they said, no, you can't leave, and Lindsay's like, watch me. But, Lindsay expressed wanting to leave, and Dr. Goodheart felt comfortable allowing her to leave. And one thing too, on cross, Kevin Reddington was able to get out of her that in her entire 20+ years of practice, she had not treated any, not just a few, any patients with presenting postpartum psychosis or just psychosis. So that would lead you to believe, well, if you've never seen it, then how are you qualified to say that she was presenting it or not? very good point by the defense. Then they called Lindsay's psychiatrist, Jennifer Tufts. Now, keep in mind, though, Jennifer Tufts and Dr. Goodheart are both involved in this civil suit that has been brought by Lindsay Clancy's family. And Jennifer Tufts was much more knowledgeable and articulate. And one thing that really struck me right off the bat was how young she looked. She looked like she was 20 years old. And they had her mention her birthday on the stand, and she said she was born in 1989. She also said the first time she saw Lindsay was September of 2022, 4 years ago, which means Jennifer Tufts would have only been in her maybe first to second years of practicing, because she had said she was only practicing for about 4 years. So that kind of took me a little bit, because there again, without the experience or without having, experience really, how are you able to say, hey, this medication is like this medication is like this, you're presenting this way? But she did mention a lot of assessment tools that she uses, and we're going to talk about those in just a minute. She said she mainly had telehealth appointments, but the appointments would usually run about 25 to 30 minutes. She established that Lindsay never expressed hearing voices or any hallucinations of any kind before. They went over that, that large packet of paperwork that they give you, where they ask you your past, your medical illnesses, your family's medical illnesses, your thoughts, your feelings, everything. They went over all those different things that she put in that paperwork. She also said that some things that help her assess that may suggest a psychosis are things like paying attention to the patient's focus. Are they able to stay on topic when you're having conversation with them? Her concentration. Her speech patterns change, if her speech patterns change or fluctuate. I suppose if that occurs, that can be another indicator of something along the lines of more of like a psychosis, when you're not able to kind of keep track with what you're doing. And she said she did not see any of that with Lindsay. Another assessment tool was to ask about their mood. Are you saying you're fine, but you don't look fine? Kind of like that commercial where the woman is sad, sad face, and then she's got the smiley face on the popsicle stick, and she puts it up in front of her face, in front of her family and her friends, but, on the inside, you know what I mean? So you're saying one thing, you're presenting another. Kind of like the actions speak louder than words type of scenario. Regarding medication, she spoke about how she prescribed Zoloft. Zoloft is a first-line SSRI, and it really goes to aid with the serotonin development in the body, not just the brain, but in the gut. And some initial symptoms that a person might experience when they first start that medication are things like loss of appetite, diarrhea, constipation, nausea. And if you remember, Lindsay had been losing weight on the onset of taking that medication. And she was also asked if, when Lindsay came back and said that she did not think that the Zoloft was doing anything, if she had increased it at that point from 25 milligrams to 50, and she said she did not.
Hallucinations or visual hallucinations?
Yes.
What was her response?
She did not.
Did you ask her questions to determine if she was experiencing any symptoms of mania?
Yes.
What types of questions you asked to determine that?
Well, a lot of it can be assessed without asking, but questions may look like, have you ever had a period of time in your life where you were excessively energetic and euphoric? I might leave it there and then follow up with some of the other symptoms.
Did any of the questions you asked Ms. Clancy related to mania or manic episodes, did any of her answers to those questions indicate that she had experienced mania or manic episodes?
No.
Now, in that first meeting, what's your exam process? Like, how do you start the meeting and how does it flow?
Sure. So I start the meeting by introducing myself, explaining what we're going to be doing for the day. Then I ask the patient why they're there. We talk about why they're there. I assess for different mood symptoms, anxiety symptoms, psychosis symptoms, mania symptoms, safety concerns. Then we start talking about the history. We start talking about the past psychiatric history, the past medical history, substance use. We start talking about other medicines that they have tried in the past or may still be taking. And it's not always in that order, but that's the general order. Sometimes things come up sooner. And we talk a bit about what the patient's goals are, what they're looking for in this time period, and then I may give some of my recommendations.
And did you follow that process for that initial meeting with Lindsay Clancy?
Yes.
Now, you mentioned that you part of the initial evaluation is looking for signs of psychosis. Is that correct?
Yes.
What types of things are you looking for to see if someone's experiencing psychosis?
So there are a number of things. They start with how the patient appears. So some signs of psychosis might be that they appear disheveled. I assess what their attitude is, if they might be agitated or very uncooperative. That's a red flag. I will assess what their speech is like. Is it very loud? Is it very fast? Or sometimes it could be the opposite, where they're not really even speaking at all. I assess what their mood is like, what they're saying that they're feeling, and how they appear visually. I assess what their thoughts are like. So are their thoughts disorganized, where it's really hard to understand? They're jumping around and you can't follow their line of thought. I assess what the thought content is. If it's particularly about anything very bizarre or very paranoid, that would be potentially indicative of psychosis.
And you conducted that type of evaluation on Lindsay Clancy in that first meeting, is that correct?
Yes, that assessment is done with every patient.
And did you note any signs or symptoms of psychosis with Ms. Clancy that day?
No.
Do you also, in addition to the observations you're making of the patient that day, are you also asking questions about their past behavior and things that have happened to them in the past that might indicate whether psychosis is an issue?
Yes.
And what types of things are you asking them about their past?
Well, I may ask, have you ever heard voices? Have you ever seen something that other people didn't see?
And did you ask those questions of Ms. Clancy?
I believe I did.
And what was her response?
No.
Thing that she spoke about as well was the difference between a psychiatrist and a psychologist. She says mainly a psychiatrist is a medical doctor who can prescribe medication, whereas the psychologist cannot prescribe medication. She said Lindsay was very hesitant to taking any medication, so much so that she pushed it off until the point where things got so bad, symptom-wise, that she really didn't have another tool in her toolbox, so to speak, other than to try some medication. She also said that just like everyone else so far, she never heard her talk about harming herself or anyone else, which, at least for the prosecution, I have to give them, is something they have been able to consistently show with these witnesses, is that nobody heard her talk about those things or say those things, except for Patrick. But that kind of makes sense because they're in a domestic relationship, you know, they're man and wife. They share, maybe you'll share things with your spouse you won't share elsewhere, like with your friends or something. I mean, but you would think that you would share those things with your psychiatrist, you know. But so far, you know, the psychiatrists for Mclean and Jennifer Tufts have said they never heard her say anything of the sorts. Oh, and they also all agree that Lindsay was, you know, nothing but a doting mother and that she loved her children very much. And I have no doubt at that. Her main points of contention were anxiety about going back to work and not being able to sleep. Those seem to be the most talked about, at least, or consistent symptoms that she was showing. And then lastly, you know, she mentioned that she met with Lindsay approximately 14 times. So, court broke for the day, and we will come back bright and early on Monday, where the defense is going to cross-examine Jennifer Tufts. So that should be good as far as maybe getting some really good information, I'm sure. So thank you so much for joining me for another episode of You Would Think. I really appreciate it, and I appreciate all of your support. If you have any questions, make sure you put them in the comment section. And remember to like and subscribe. And we will meet again.